Okay, can you see? Okay, we're live. Hold on, let me. Okay, perfect. We're live, and let's see if anybody's joined us yet. Yes, here we are. Okay, so let me say hello to everyone. Hello, my lovely people. That's what I usually say in all my videos. So why not today? Hello, my lovely people. A very warm welcome to everyone who are joining us today on this live. Today we have a very special guest with us, Dr. Namrata from Sunshine Skin Clinic. She's a skin, hair, and laser surgeon in Delhi. Her clinic was awarded the best skin clinic in Delhi in 2017. She has also been featured on NDTV, Good Times, Radio Mirchi, and Radio City. You can also find her on Instagram at Sunshine Skin Clinic Official. And today, Dr. Namrata is present here with us to answer your questions regarding skin and hair. For today, I already have a few questions for Dr. Namrata that some of you sent me, but this will be an ongoing series. We will be coming live every Sunday at 6 p.m. Indian Standard Time. So if you have any queries or concerns regarding skin and hair, please feel free to email me at Kritie.Robertson@gmail.com. And don't forget to subscribe to my channel. I post videos about makeup and skincare every Monday and Thursday, and we also have these live episodes on Sundays. So let's begin the Q&A with Dr. Namrata. Hello, Dr. Namrata. Thank you so much for being here. How are you? And
I'm
first thing, can you tell us a little about yourself and what sort of things do you help people with in your clinic?
Hi everyone, and thank you, Kriti, for giving me this opportunity to come live with you and answer questions about skin and hair. I am a dermatologist, laser, and hair transplant surgeon, and I started my clinic in the year 2004, so it's almost 16 years now. And I do various
Wow.
kinds of, skin and hair treatments. I do hair transplants. I am trained with all kinds of lasers. It could be a full body laser hair reduction. It could be a skin tightening laser. It could be about your birthmarks, your tattoos, which many people do, but then they want to get it removed later. And we do a lot of
Yeah.
anti-aging like thermage. We do therapy. We are into fillers, threads, Botox. We do so many things, but then we have to, just judge as to what is, specific for a person, what they need. So we are into all kind of
Yeah.
non-surgical cosmetic treatments, and I also deal, since I'm a dermatologist, I also see about all the skin, hair, and nail issues. So doing everything
Yeah.
under the sun. Yeah.
Yeah, I mean, a lot of people, when they think of, dermatologists, they think acne or, some very normal, regular, daily basis kind of problems. But actually, you do quite a lot of things, and people might not, you also do hair transplant and things like that. And there's a lot of stigma as well around these kind of things. So it's good to have you here, and it's good that you can tell everyone that these are also the things that they can come to you for.
They can definitely visit me whenever somebody comes to my clinic. I first do a basic check, and my aim in treatment is to find out the root cause, whether it is a skin issue, hair issue, or nail issue. What my mantra is to find out the root cause and then accordingly treat. It's not important or it's not necessary that if you're working in my clinic, I am going to do a treatment. It may just get cured by medicines and some home remedies also. So we are genuine and fair,
Yeah.
guide you correctly as to what is really required for you.
Yeah. Okay, so okay, so we have a few questions. I was asking around on my Instagram and some other places and some friends if they had any questions they could ask you. So I have some questions for you from some people. So before we begin, I'd just like to say that I did receive a lot of questions to ask Dr. Namrata and on behalf of the people. But since today's session is only 45 minutes, we can only cover a few questions, and the rest of the questions I will keep for the next Sunday. So please, viewers, don't feel bad if your questions didn't get taken today, because we will be taking them next Sunday. So, yeah, so first question is from Ashfia Jahan. She says, how to promote hair growth? My hairline is reducing drastically every year, and I really don't know what to do. I'm just in my early 20s. My hair texture is also changing. I've always had straight hair, and now most of my hair is wavy and frizzy, and my front hair is growing to be curly. Would want to know the reason behind it. I also want to know any remedies to get rid of stubborn acne marks that I have probably from my teenage years. She doesn't have acne, but only marks, and would be really grateful if you could answer these questions. Thank you.
Okay. So thank you so much for your question, and it is a very relevant and an important question. Many of the people are facing, a receding hairline, may it be males, may it be females, more common in males, less in females, but nowadays due to so many hormonal changes and environmental changes, people are experiencing this. So what are the causes of hair fall or a receding hairline or straight hair getting curly? So first of all, what about your nutrition? There could be so many nutritional deficiency. There could be vitamin D is a very very important cause. And if we go and check vitamin D, everybody has that below normal values. So vitamin D, vitamin
Yeah.
B12, whether your liver is functioning fine or not. If you have any kind of thyroid problems, it could be hyperthyroidism, wherein you are getting thin, or it could be hypothyroidism, wherein you are getting, or gaining weight. So you have to rule out these conditions. Hemoglobin, what are your iron levels? So all these are major causes. Anybody who's having a receding hairline or hair fall, you have to rule out these causes. So I'll repeat again: vitamin D, B12, liver, thyroid function tests, your hemoglobin, and your iron levels. These are very very important. Other thing which is
Yeah.
very commonly seen in females these days is PCOD. Now, what is PCOD? We keep reading about it, we keep talking about it. So it is basically polycystic ovarian syndrome. What happens in this is that your ovaries, the egg producing organs in a woman, in there are small cysts which convert the female hormone into male hormone. So if the male hormone goes high in a female body, she'll start having hair fall, she'll start having a receding hairline, she'll start seeing baldness on her scalp. So this is also very important. And earlier days, we used to say that people who are putting on weight usually have PCOD, but nowadays the criteria has changed. Even I get patients who are very very thin, and still, when they come with the characters like hair fall or acne problems, when we do a scan on the second or third day of menstrual cycle, we see cysts in their ovaries. So, we have to rule out this also in females, whether their periods, whether their cycles are regular or not. And we have to do this scan. So maybe they have PCOD or cysts in their ovaries, because of which they are also having hair fall. The other trend which we are seeing these days is that in young age also, even if you do not have gray hair, we have a tendency to color our hair. We do keratin, we do smoothing, we do straightening, and we use all kinds of chemicals on our hair. Now, what is basically hair made up of? It is made up of proteins, and hair is binded by hydrogen sulfide bonds. So, any chemical like a keratin or a smoothing or whatever, it has to break those bonds in order to give your hair that luster and that straightness. So, when these procedures are done
Yeah.
again and again, it also weakens your hair. Another thing is coloring. People are coloring their hair into different shades. Whatever is written, even if it is written ammonia free, it does has some quantity of ammonia and a chemical called PPD, which again destroys your hydrogen sulfide bonds, making your hair weak. So you are falling into which category? Are you eating right kind of food? Are you having enough proteins in your diet? Are you sleeping? Are you working along with your biological rhythm? Sometimes people are, working with call centers, or their jobs require them to wake up the entire night. So again, their biological or the
Yeah.
circadian rhythm is disturbed. So even if they feel that when they come home in the morning, they are sleeping for 8 hours, but their cycle is totally disturbed. There are some kind of hormones known as stress hormones, which are high in the morning because our body has to remain active. So when we get up, they get activated to keep our BMR high and to keep us active. But in the evening hours or the night hours, they start falling down. So that is they monitor the circadian rhythm. But people who are awake in the night, their stress hormones are high in the night as well as in the morning. So this is also a very major reason of receding hairline, hair fall, and acne on the face. So if I summarize, there are a lot of reasons. There could be, the vitamin deficiencies. Again, I'll repeat: vitamin D, vitamin B12. You could have some problems in your liver. There could be hemoglobin issues wherein your iron levels are less. There could be some thyroid issues. Again, there could be a hormonal disturbance known as polycystic ovarian disease. Maybe you're not eating the right kind of food. There are lack of proteins and enough nutrition in your diet. You are following too much of a keto diet, or if you're dieting in the wrong way. So that could be the issue. Again, maybe your circadian rhythm is disturbed. You are not sleeping well, and you're using a lot of
Yeah.
chemical treatments on your hair. So all these things lead to receding hairline and hair fall. Again, a very common question asked is that why my straight hair is getting curly. Now, this is a genetic component. So, for some people, the curly hair comes from their parents, and it is, it is seen during birth time or in their younger ages. But sometimes this trait develops late in the 20s also. And the other causes of having curly hair, which is basically an asymmetrical hair follicle, could be due to your nutritional deficiencies, basically the deficiency of copper, or maybe people who are on medications for cancer treatments, or people who are on treatments for epilepsy or fits. Such medications can also make your hair curly. Another thing is stress, pollution. It could be a pregnancy bone curliness in the hair also, because hormonal changes in female body can also make your hair curly. So, under which category you
Yeah.
are falling, you have to see. These are the reasons. Now, what you have to do about it, how to get rid of this, you have to first take a look of all these features. If you are having any problem here, you have to correct it. Now, once these all problems are corrected, then we, do special therapies. We give you multivitamins, which are rich in everything. We have special serums which stimulate hair growth. We
Yeah.
give that. If in case, in spite of that, also your hair fall is not getting controlled, we have two types of therapies. The famous one is a stem cell therapy, or known as platelet rich plasma derived therapy. Now, what happens in this is, if you see that if you get any kind of wound or any kind of injury, your body heals gradually. You see that the body is recovering. So this happens because our blood has special kind of growth factors. So what we can do for such people, if their blood parameters are good, we take some blood, we centrifuge it, in some special tubes, and withdraw these growth factors from blood, and we can inject this in your scalp. So once we do that, it promotes hair growth. you know Other thing is that some people
Yeah.
whose blood quality is not good, there are, artificial derived stem cells known as growth factors. If you see my Instagram page also, at Sunshine Skin Clinic Official, I have given a full chart about growth factors. So that is another thing which can help. But in males, this is a female who asked me this question. In males, they suffer from a condition known as androgenetic alopecia, whereas it is hormonal. Now you go, this is the front side of the scalp. So if you see, the baldness
Yeah.
comes here. It is never seen on the back side, because this part
Yeah.
of the scalp
Yeah. It
has
starts with
receptors
here. Yeah.
here. So this part of the scalp in females and males is both rich in a receptor known as 5-alpha receptor. So in females, it is usually post-menopausal. Before that, they will not experience baldness. But exceptions are there, like this female, if they are having some problems. So these receptors in the males, they have a hormone known as testosterone. So it binds with these receptors to form, something known as DHT, dehydroepiandrosterone. This is a hormone which will give rise to baldness and hair fall, because it stimulates collagen formation around the hair follicle, and it stops the blood circulation. So gradually males start getting bald. So if the baldness has reached a higher level, we have a scale. If you can Google, it is known as the Ludwig scale. So there are 1, 2, 3, 4, 5, 6, 7. So in case you have that kind of baldness, then a hair transplant becomes mandatory. So we have to really check as to
Okay.
what problem you are facing. And as she asked
So
about the
transplant is not the only option. You can
no, no,
also, bring your hair back naturally and change your
yes, we
lifestyle
can.
and things like that.
Yes. See, lifestyle is the most important thing because all the problems start only from a bad lifestyle. If you're leading a good
Yeah,
lifestyle, your skin and hair will be good for a very, very long time because your skin and hair is all about how you're eating, how you're sleeping, what kind of diet you're following. Now, I see many people who follow, rigid diet plans, they lose weight and they again gain weight. So there is no fun in doing all this. You have to have a certain form of eating habit that you have to eat in so much quantity so that you can enjoy all kind of foods without putting on weight. And you have to exercise.
yeah,
Exercise boosts up the circulation, which is really important for the good health of your skin and hair. So I believe that you will be 90% is your work, 10% is my job. Because if 90% your lifestyle is good, my job will be reduced to just 10% with excellent results.
yeah.
Yeah.
Yeah. So to summarize, the person who asked the question, they should just first of all check the deficiencies for their vitamins and iron, and then they should also get tested for their hemoglobin and if they have any thyroid issues, and then again, yes, focus on the lifestyle and you know those kind of things. So yeah,
Yeah.
that was very helpful and it was very elaborate. You answered in a very elaborate way. So no matter what, someone will definitely fall in one of those criterias.
Yeah.
So yeah, that was very helpful. And I'll go to more questions, but someone has just on the live chat right now has have asked us how to repair split ends. If we can just bring that in quickly.
Yeah. So see, I being a Sardani, usually they say that if you trim your hair from below and you can get rid of the split ends. But in some communities, like I am a Sardani, in Sikh community, we cannot cut our hair. So but still, how people like us or many people can get rid of split ends? Castor oil. Castor oil is a very, very beautiful remedy. Whenever you wash your hair, you can use that castor oil on your the roots of your hair. See, I have this curly hair, but it's not frizzy. So you can use castor oil. Plus, there is a very beautiful product in the market. I'm not here to market or publicize any product, but Matrix has a very good product known as Biofoliage, which has grapeseed oil, which has avocado oil. So these grapeseed oil, castor oil, and avocado oil. Whenever you wash your hair, you can apply a mixture of these oils on your hair ends, and believe me, you will not face this problem of split ends, and your hair will be less frizzy and you can manage, because many people can't do too much of oiling. And since I've come to this point, even if
Yeah,
you're oiling your hair, oil your hair only for half an hour to 45 minutes. That's more than enough. And wash.
yeah,
That grandma therapy of keeping the oil the entire night has long gone away. It can give rise to oily dandruff, giving rise to more acne on your forehead and in the back. So, grapeseed oil, avocado oil, and castor oil you can apply on your hair tips after you wash your hair and your hair is slightly wet. So, that will prevent split ends.
so so you're saying that you don't have to cut the split ends with the oil. You can actually repair the hair.
Repair. Repair the cuticle and it will not look split or damaged. It really helps.
Okay. Okay. So I've read this somewhere that if you don't cut, I mean, it might just be a myth. So you can tell me if I'm wrong.
Yeah,
So I read somewhere that if you don't cut your split ends, it splits the whole hair to till your scalp, and so yeah, yeah. When I heard your answer, I thought that's probably just a myth.
because many people think that if we don't trim our hair will not grow. But actually, do you realize that the hair follicle, or the root of our hair is in the scalp? So hair actually grows from here and then it picks up its length. So the hair which comes
Yeah.
below, it's just going to get dead and it's going to get shed off. So basically, whenever we massage oil also, or whatever nutrients or mask, we usually apply on the hair roots. ऑयल स्पेशली वी से ना कि जड़ों को मसाज करिए, So it's the roots, it's they are on the scalp from where the hair grows. So trimming has nothing to do with it. It can just because of split ends, your hair may look frizzy. So that trend came that you cut, then only your hair will grow. But this is just a myth. It is a
Yeah.
myth.
Uh, yeah.
Yeah.
Yeah. Thanks for clearing that, because even I personally had had that query.
And
Okay.
there is
Yeah.
something known as that the Sardars do not cut their hair. So how come they have such long hair if you observe? They do not cut their hair. So it is just a myth. The Sardars do not cut their hair. So how come they have such long hair? If you observe, they do not cut their hair, and still the Sardanis have very, very long hair.
Yeah.
The Sikhs are not.
Yeah. That's
So
true.
it's a myth. Yes.
Yeah. Okay, so let's go on to the next question. The next question is from Roma. Roma has shared some pictures and she's asking that she has this mark on her cheek which hasn't gone for 6 months. It appeared when she fell sick with typhoid and it has not gone. And also, she has shared some pictures of her hands. She has some damaged skin, and it gets damaged very easily. Just with, she said, just with water it gets damaged. So let me see if I can share the pictures that she shared with us. So that's her hand. um,
Okay.
so hold on. Yeah, that's the front of her hand, and then that's the back.
Okay.
And then she also has a something on her face that hasn't gone for quite a while. So it's getting uploaded. Okay, here. So that thing that you see on her cheek, it's actually a yellow, very big yellow spot. So yeah, that's her concern.
Yeah. So, Roma, first I'd like to ask, in lockdown now, most of us we don't have maids and we are constantly washing our utensils. So, the kind of allergy she is having on her hands is a form of contact dermatitis and allergic dermatitis to detergents, especially if you are washing utensils or if you are washing a clothes. So, all those detergents, those Vim bars and those surf, they have some chemicals which are corrosive for our hands. Then again, in this corona time also, people are using a lot of sanitizers. So sanitizers also have chemicals which can give rise to such corrosions. People are using Dettol hand washes. Again, Dettol has some kind of chemical which is corrosive for the skin. So Dettol is not a very a good option to wash your hands. You can use some, Lifebuoy mild or some mild hand washes. Now, if you're using detergents in the kitchen and if you have to wash utensils, which we cannot, deny, we are all doing it. So wear some gloves, rubber gloves, especially to wash utensils. So even if I give creams for this may get cured, but again, when she'll be exposed to detergents, it'll come back again. So again, as I said, we have to hit the root cause. So wear some gloves, some rubber gloves. They come in the market to wash your utensils or to wash clothes. Please do not use very, very harsh sanitizers. Do not use Dettol hand washes. Use mild hand washes. So this will take care. This could be taken care with a combination of any mild steroid, a moisturizer, and an antibiotic cream. Could be a fluty backed ointment or a Fucibet cream, and you have to mix it with any kind of moisturizer. It could be Corolin, it could be aloe vera cream, it could be aloe grace cream. So such combinations will help to cure this. And again, if you have to strengthen your hands, you can do take some lukewarm water. After your hands are healed, squeeze a little lemon and soak your hands there for 5 minutes. So it will make your skin healthy, but not in this circumstance. Once the hand is healed, she can use this remedy. And as far as that
Okay.
stubborn, that yellow thing is there, that is that.
Can I say something about the hand first, because I think Roma is watching and she's written a few things on the chat. Do you think it could be something else apart from the detergent and the soaps? Because she says she does not wash utensils or doesn't wash anything. So do
Okay,
you think it could be something else?
then she has to check for her vitamin D. because if there is no exposure to any kind of irritant, then 100% vitamin D deficiency or a thyroid problem can give rise to such inflammation of hands. And is she experiencing cracked heels also? Cracked heels?
Uh,
Uh,
okay, Roma, if you're watching, can you answer? Do you experience cracked
cracked
heels
heels?
as well? She's saying I prefer washing hands with soap. She does not use hand sanitizers as well.
Okay. So it could be a vitamin D, it could be a thyroid, it could be a vitamin 12, B12 deficiency. Vitamin D deficiency can give rise to cracked heels and inflamed hands. So that was also a study done by some countries, and when we checked for their vitamin D levels, they were less, giving rise to such problems which were recurrent and were not getting corrected, was coming and going. So probably she can check her vitamin D and thyroid and B12, so maybe that will help.
Yeah. Okay,
Yeah.
so she
So
says she
Roma,
does not
like,
have cracked heels as well.
so she
So
can
I
check
think yes, Roma,
it.
she needs to check the vitamin D
D.
levels.
Yes. And then get back to
Yeah.
us and we'll
Okay.
explain that as to how we can help.
Okay. So and her um,
Yes.
this yellow spot on the face.
This is a fat deposit, also known as a small xanthelasma, small patch, which can come in pregnancy. So this can be cauterized and she can be taken care of. It's a technique known as radio frequency. You can visit your dermatologist. She can put a local anesthetic cream for 30 to 45 minutes, and then with her RF probe, she can just burn it and it will heal within a week. So it's a day procedure and it can be removed, but it has to be removed through a RF technique. It cannot be treated by any kind of topical applications. It's a small
Okay.
fat deposit.
Okay.
That's why it's yellowish in color.
Yeah. Okay. But is it common to get these kind of fat deposits?
Yes. It is very common. Some
Okay.
people have fat deposits around their eye areas. If you see here, they are known as xanthelasmas. And some can have these small, small ones on the face, on the forehead. But these are treatable. These are good xanthelasmas which can be treated. So she can visit her dermatologist nearby, wherever she is living.
Okay. All right. So Roma, just to summarize your question, you should check for your vitamin D deficiency, and also this spot that you talked about on your face. You can visit a dermatologist, and it can be removed. Okay, so moving on, we have same questions from two different ladies, Dhara and Sharon. They both have asked about heavy hair loss and again hair thinning, and
So I,
how can they increase hair growth.
so I have told in detail about hair. They have to check out the root causes, and I think I have just discussed about hair in detail. So I think they, I'm sure they were listening to me.
Yeah, yeah. Okay, so because I think this is something that a lot of people face the hair issue, hair fall, hair thinning. These are some things that a lot of people have problems with, and I had multiple questions regarding the same thing. So this video will get saved if whoever's watching, if you weren't there in the beginning, Dr. Namrata talked in a very big detail about hair thinning, hair fall, and everything. So if you weren't watching, you can always go back to the recording of this video, which will be on my channel. So we can move on to the next question.
Yes.
So Shaina asks how. Oh, again, sorry. This is also about hair fall. She says, how can she stop hair fall and stop hair graying? She's only 20 years old and she has hair graying.
Okay, see, hair graying is another very common question which comes to me. Many people who have hair graying have some kind of sinus problem. That is a link there. Do you suffer from lot of cold, cough, or do you have blocked sinuses? Or people who are having again nutritional deficiency. It could be vitamin D, it could be vitamin B12, and having gray hair is also genetic. Sometimes your parents, your mother, father, or your grandparents, or some distant relative, maybe has gray hair which has come faster, and it could be a genetic reason. So now how we can prevent graying? And then again, some people use hair colors, and again, whatever is your normal hair also turns gray. So there is a homemade remedy to prevent graying of your hair. Firstly, what you can do is, you all know what is amla. We all eat amla. So you can get some amla
Yeah.
powder, dry amla powder from the market, and you can make a paste out of it.
Yeah.
Like, you put some water, make a paste, like a semi-solid paste, and you can apply on your entire hair like mehendi. As we do mehendi application, keep it for 2 hours and you wash it. So that amla will
Yeah.
prevent, that amla powder lap or that mask will prevent further graying of your hair, and whatever hair has turned gray also, that also will turn a lightish brownish blackish tinge. You should also consume one amla every day. If it affects your throat, then you can have it in the form of a candy or a murabba, but you can wash it so that the sugar content does not go high. Because some people, if they eat it
Yeah.
as it is, it gives them sore throat. Or you can put it in your vegetables or dal while it is getting cooked so that it gets cooked. So vitamin C
Yeah.
basically is a very rich source of making your prevention of graying of your hair. And also you have to check for your vitamin D and your vitamin B12 levels. And also there's a tablet by the name of biotin or Folihair, which is rich in calcium pantothenate. So if their graying is too much, you can consume these tablets, which are rich in biotin, calcium pantothenate, zinc, copper, manganese. So they will also prevent graying of your hair. Avoid coloring your hair,
Yeah.
and if you have any ENT problems like sinus or anything, please control those problems by taking steam or whatever measures. And pranayam. Pranayam is a yoga asana. Pranayam, all the 5 steps of pranayam really help to increase the circulation and prevent so many problems in the body, thyroid and graying of hair and PCOD and everything. So you follow pranayam yoga asanas and they will really help. Basically, a good lifestyle. Yeah. Yes, Amla is
So
good.
I just want to
Yeah.
Yeah, so I just want to point out one. I will just repeat something you've said,
Yeah.
because a lot of people go to coloring. People put different colors on their hair to try and hide the gray hair, and this
Yeah.
is a very important thing that you mentioned, that actually it makes your other hair as well gray as well. So
Yes.
it's probably not the best solution to try and hide your gray hair. So if you go for more natural remedies, that would be more helpful than coloring or dyeing your hair, because then you're applying more chemicals and hurting your hair even more.
Yeah, and there is a product in the market known as Indus Valley. It is manufactured in France and it is there all over the world. It is there in US, Australia, New Zealand, all over the world, and it is made up of 16 natural herbs. So that also has amla or gooseberry as one of the component. It has indigo. So all the natural things. This is a safe uh, uh, dye to use for your hair. It comes in a gel form and it has no PPD or ammonia, though the color goes off in 16 days.
Yeah,
But it is a safe method to hide your hair if at all you have to color your hair, and it comes in all the hair colors. It is a dark brown, it is a medium brown, it is a black, it has burgundy, it has blonde. So it has all the colors, and you can find it online also. You can order. It is known as Indus Valley. It
yeah,
is a very, very good product.
yeah,
I have personally tried it and given to many patients because I get many clients who develop a dye allergy. So you know what they will do then. So there is a product in the market which is internationally renowned, and you can try it out. And it comes in a powder form also. People who are intolerant to the gel can use the powder. You have to keep it for a long time, maybe 1 or 2 hours, and you can heat it with a dryer and then wash. Maybe in first time when you apply, you may not get that coloring. So you can reapply after 2 to 3 days, and then you will see a good color. And even the beard hair, which is a hard hair, can be colored with Indus Valley.
yeah.
If at all you are
Okay.
keeping beard and you need to color your beard, even. Yeah.
Yeah. Okay. Moving on to the next questions. Mandeep Kaur asks, is mixture of almond oil and vitamin E oil okay to use as a night cream, or is there any night cream that you recommend?
See, again, whenever you have to use any product on your skin, you should know what is your skin type. Is your skin oily? Is your skin dry? Is your skin combination? Is it sensitive? Is it acne prone? So, if you're using almond oil and vitamin E oil and your skin is dry, then it is okay. But if a person is having an oily skin and trying to use these oils, they may get breakouts. So, you have to decide what kind of skin type you're having. Now, if you're having a dry skin, you can use almond oil, you can use vitamin E oil, you can use these things. Another products which help, in skin tightening are honey, hyaluronic acid, and collagen. And again, vitamin C, retinols. So all these products help in skin tightening. Hyaluronic acids, collagens, vitamin E's, almond oils, aloe vera, and what you say, retinols. So again, if your skin is very, very dry, you cannot use retinols. You have to use them in combination with good moisturizing agents. If your skin is very, very oily, then you can go for serums. Serums rich night creams, because serums are not very oily, but they give you the right anti-aging component. So for such people, hyaluronic acid, vitamin C, and collagen would be the best option. For people with a dry skin, almond oil, honey, aloe vera, vitamin E could be a good option. Another option in the market is Kumkumadi serum. It comes under various brand names, from Forest Essentials, from Khadi, various. Even it comes under my brand name.
Yeah,
We have it as Noora by Sunshine. It is our product also. So Kumkumadi serum can also be used as an anti-aging serum, but not for all skin types. Please determine your skin type before you use any product, so that instead of
yeah,
giving you any benefit, it doesn't harm you or gives you breakout. So, Mandeep, if your skin is
yeah,
dry,
and
you're doing good. You can also try Kumkumadi, but if your skin is
y-
oily, try hyaluronic and vitamin C.
yeah. Yeah, and I think I'd just like to add that that goes on with everything. If you're choosing skincare products, or even if you're choosing makeup like foundation, like face makeup, everything, you need to know your skin type, because all the products work differently on all different types of skin. So, even the makeup brands, they also make foundations and all these products for different skin types, and they make different lines of foundations for different skin types. Some might work for oily skin, some might work for combination or dry skin. So I think it's very, very important to know what type of skin you have, and then it makes it a little easier to choose the right products for yourself.
Very true.
Yeah. Okay, so Mandeep, you need to find out what type what type of skin you have, and then you can take Dr. Namrata's recommendations on all the products and the things that she mentioned. Okay, so we'll move on to the next question. Um, okay, that's also another hair question, and I feel like you've already answered that, so I'll move on to the next one. Okay, Anovara asked, she says, hello, I have oily and acne prone skin. I have acne marks all over my right cheek and some on my left cheek. There are also some acne, now spots on my jawline. The pimples reoccur according to my cheek, around my cheeks every day, and sometimes from on the same spots. I have been taking hormonal medicines for irregular periods and ovarian cyst from the age of 14. Now I'm 25 and I sweat a lot. I have only used Neutrogena acne face wash and only balancing scrub, but it's been a month that I have been using a Some by Me. She said it's a brand, Some by Me, 30 days miracle toner and serum, and I still have same active acne and a lot of stubborn spots. I really want to get rid of these acnes and spots. How can she do that?
Okay, so this is again a very relevant question, and you know what she's facing from is polycystic ovarian disease, and she has been taking medication from the age of 14. So, can you ask her that is she overweight or is she normal weight? Like, what is her weight and everything? Like, can we get to know that? Is she thin? Is she fat? Is she like?
Um,
Is she there right?
I'm not sure if she's watching right now. Anovara, are you watching? If you are, can you please write, say something? Um, I think,
She's not
yeah,
there.
we probably won't know that right now.
See,
So you can just explain according to both scenarios.
yeah, see, 9 years is a very long time for us to give PCOD medications. It's not very safe also to give hormones for 9 years. So, you can share her number with me or whatever. I really need to understand as to why is it taking 9 years for her PCOD to get treated. Now, PCOD people are of two types. One could be people who are obese. The other could be a category of thin people. So, see, we can give hormonal treatment or medicines maximum till the age, till the time of 2 years. Beyond 2 years, if we are continuing to give allopathic uh, hormonal medications, it could have other side effects. So, if you are a person who's obese, please make it your, aim to reduce weight by 10 kgs, 12 kgs, whatever is your overweight range. You have to come back to normal range, because once you become thin and you lose your extra fat, your PCOD will disappear completely and your medications will stop. So PCOD only, those cysts in which more of male hormone is getting produced, only give rise to that oily scalp and oily skin and acne. So even if you are under medications but you are not improving your lifestyle and not reducing your weight, and eating medicines for 9 years is coming like a horror to me, as if how many other side effects you will get. So please work on that. Now, if you are a thin person and having PCOD, then again we cannot give you allopathic medicines for more than 2 years. So for such people, see, if they are unmarried, once they get married and have kids, there is some improvement in their hormonal profile. Otherwise, if they are still not responding, they have to go to alternative medicine like homeopathic medicine, which can be given for a long time without giving you any side effects. But please do not take allopathic treatment for more than 2 to 3 years, because the hormonal tablets which we are giving can have side effects. So we are basically trying to curb the acute phase. We are not going to give it forever. Like this client is having medicine since 9 years. So I really don't know that how she is having for such a long time. Because if you are given the right kind of medication, it should not go beyond 2 to 3 years. Unless and until it's a chronic case,
Yeah,
again we'll monitor, we'll give you a good diet plan, we'll give you lifestyle modifications, we'll tell you to do yoga asanas. Believe me, pranayam is the best yoga asana to cure PCOD if you're doing it sincerely. Do it with a trainer, do it in the correct form, and you can actually get rid of PCOD. So, still, if you
yeah,
are a chronic case, then switch on to homeopathic medicine. Please do not have hormones. Though I am an allopathic doctor, but for my clients also, I switch them off to homeopathy. I send them to a homeopathic doctor, and then they do well. So we have to treat the root cause. So once your PCOD is treated, you will not suffer from oily scalp or hair fall. So her PCOD is not getting treated correctly. So I really don't know. So I need to talk to her as to know that where is the problem, because it doesn't take 9 years. Maybe she's not following a
yeah,
good lifestyle, or she's overweight, or there is some loophole somewhere which I need to understand. You
yeah.
know.
So you think PCOD can it be treated by just lifestyle change?
Yes, there are, usually whenever we feel that a person is having PCOD, we do a ultrasound on the second or third day of period. So in that scan, we see that what is the severity of the problem. So there are various stages. If it's in the beginning stage and it is borderline, it can be cured by lifestyle modifications. But if it is advanced and it is progressing, then we have to do other blood tests, we have to check for other blood tests, we have to check for other hormones. Then we have to introduce medications. So we have to check by the scan as to which stage it is. It could be stage 1, stage 2, stage 3. So according to the severity, we have to decide as to what we need to do. And because of PCOD, you may have hair fall, you may have resistant acne, more of jawline acne. See, if you suddenly experience jawline acne,
Yeah,
this jawline acne is due to PCOD, and it is a hormonal component. If you're getting on the forehead, it is due to dandruff. It means you're having oily dandruff. Probably you're not drinking enough water, or you are applying oil overnight, or you're using some kind of creams which have that comedogenic or the acne producing factor. But PCOD will always give rise to jawline acne. So by seeing the position of acne on your face, you can know as to why and what is the reason for getting acne. And drink lots and lots of water. I missed to add that only anti-aging creams cannot give you a good anti-aging effect. Drink lots and lots of water because there's a substance called collagen in your skin which needs to be nourished. So if you are hydrated and if you are drinking enough water, that also peps up your collagen. Definitely put a sunscreen, even if you are sitting in front of the laptop or you are under LED lights or having all those phones, they emit something known as blue light. So it gives rise to a digital damage. So even if you are sitting at home, please put a sunscreen, keep reapplying the sunscreen, eat the right kind of food, drink lots of water. So all these components will also help in anti-aging. Only creams alone, believe me, if you use an Elizabeth Arden also and you're not sleeping well, you're not eating well, you're not drinking well, your lifestyle is not good. The high kind of facials and the creams can also not prevent you from aging or may give you a dull skin if you are not apt with all the things. So water, sunscreen, enough sleep, exercise, food, all together give you a good, healthy, glowing and tight skin. So everything has to be done.
Yeah. Yeah, someone has just thanked you for sharing very useful information about PCOD. So people are
Mhm.
finding it very useful. So thanks so much for sharing that. And we've only got 15 minutes left. It's gonna be 1 hour since we started the live, so we'll be leaving in 15 minutes. So I'm just gonna take one last question. Um, Okay, so Fariha says, my skin is oily and I usually get pimples because of stress and stuff. That was not a problem, but nowadays my acne marks are becoming permanent. So, what should I do about it? I use face wash 3 to 4 times a day because of having oily skin. And another problem is whiteheads on my nose. I have tried everything starting from strip to taking steam, but nothing works. My age is 23 and I have a very oily skin.
So, basically, what I'm seeing in all the questions is that they have oil, acne, and hair fall, and all these are very common issues. So, as I said earlier, that if you have an oily skin or an acne prone skin, you have to work on your lifestyle. We have oil glands on the face, which they harbor a bacteria known as P. acnes. So this bacteria also loves oil as we like the oily food. We like the puris and we like the fried stuff. So we have to first see if we are getting too much of oil as to what kind of food we are consuming. Are we giving this bacteria a lot of oil and it is proliferating to give us those whiteheads and blackheads? So you have to monitor your oil content as to what kind of oil you are having, whether you're drinking enough water. Again, if you're oiling your hair, are you keeping it overnight? Or you're using any kind of moisturizers which have something like a shea butter or a cocoa which is giving rise to more acne. If you google, there's a list of creams which have some kind of products which give rise to whiteheads and blackheads, so that list will come out. So whenever you're using a moisturizer, counter check with that list that are you using any such kind of product which is giving rise to acne. Then again, if you are having an oily skin, there is a very good face wash which should contain a beta hydroxy acid like salicylic acid. There is a product, salicylic acid or a glycolic acid. Glycolic is a alpha hydroxy acid and salicylic is a beta hydroxy acid. These are mild acids for the face which remove excess oiliness. So men experience more oiliness compared to females. Or sometimes you may be working more outdoors and more humid environments, so you have to wash your face 3 to 4 times with face washes rich in salicylic, tea tree oil, and glycolic, which will keep the oil at bay. Keep drinking enough water and use some moisturizing creams which are not very oily, like products in the market. Neutrogena has a oil-free moisturizer. Another component is known as Acne Moist Cream, which is also good. Then there's a product in the market by Cipla known as Externa Cream, which is again an oil-free cream. So use these products. Then if you are a female and having too much oiliness, again rule out your hormonal components. Sometimes some people or some females are on oral contraceptive pills. Again, oral contraceptive pills can give rise to oiliness and acne. So you have to rule out that thing also. Then my advice to all the viewers is please take other form of protections, but never, never, never have eye pill. It is very, very dangerous. Eye pill can give rise to permanent whiteheads, blackheads, and also pigmentation on your face. It is very harmful. Oral contraceptive pills as such are harmful. So if you can modulate some other methods of family planning, it will be really nice, because such pills also give you lots and lots of harmful effects. Another important thing is that if at all you have got breakouts or acne on your face, please do not pick on them or break them, because if you do this also, it leads to permanent scarring and marks, which is a very, very common practice. If you have acne, you feel very good, you get some, I don't know, some pleasure out of bursting that acne. I don't know. It's a very common thing, but that can lead to permanent marks.
Yeah.
So just see what you can
You
do
know,
about
there's also a lot of videos on YouTube where people are doing that, and there's millions and millions of views. People are watching and finding it very satisfying to watch pimple popping and things like that. So
people
yeah,
pop
I
up.
don't know what satisfaction people get, but definitely it's not good for your skin.
See, pimple popping is not good for you, but you are increasing the business of dermatologists by popping your skin, giving rise to marks, then running to the skin clinics for getting cured. So please hit the root cause, have a good lifestyle. Do not do the small, small mistakes which can, create trouble for you. So, though I am a doctor, but I will try and give you the right advice so that you don't get into that kind of trouble where, because face is very important. If you have those marks and those pits, your
Yeah,
confidence gets shattered. So why you want to do all this when you can just take care by small, small basic modifications? And then, many people
yeah,
walk into my clinic saying they are stressed, we are under anxiety. So stress, anxiety, mind tension are also major reasons which could give you hair fall, acne, can give you hormonal disturbances. So see, everybody has their phases and we all are under anxiety and stress, but we should know how to manage it. So every time we can't even sit and do meditation. So what I follow is that if you have any kind of trouble, please take a piece of paper, write down what is the problem, what is your issue. It could be different for different people. Then write sub options as to what is the solution. Can this problem be solved, or it has no solution? Definitely every problem has a solution. So you have to find, because if you're worrying, is the problem getting solved? It's getting worse and it is hitting on your brain. Once your brain gets hit, then your skin and body starts getting hit. So you have to find out as to what is causing you anxiety and what is the solution for that anxiety. You have to work upon that and to stay positive. And another mantra is the visualization effect. You know what you want. Sometimes, a patient comes to me and says, ma'am, I want to have a pimple free face, I want to have good lush hair. But all the time what they are thinking is of what they don't have. When they'll go and watch their face in the mirror 10 times, oh my god, I have such bad marks on my face, oh my god, my hair is thinning. So every time you are giving a negative signal to the universe. Why don't you start
yeah,
imagining for 10 minutes every day that my face, my skin is all flawless, my hair is all good, and stop going to the mirror and seeing your face. Once there's a problem, find a solution, work on the solution, and stop focusing on the problem again and again, and visualize positivity. And believe me,
yeah,
if you see the positive vision, that positive vision becomes reality. So, if you have any kind of problem, see, every problem has a solution. Just stay positive and focus on the solution, and whatever you desire, only give that signal to the universe. Say, like, your question will be framed like, I want to look beautiful and I want to have a glowing skin. Do not give a signal like, oh my god, my skin is so bad. Then will it go good? So you are just giving negativity. Give a positive signal. Yes, I'm getting treated. I'm doing right. And soon I'll have a glowing and a lush skin. And it will really, really work wonders.
yeah. Yeah, that was a very, very good thought, Dr. Namrata. Thanks for sharing that with us. And I also say that to a lot of people, and you can't say that enough. You need to stay positive and say good things about yourself. Make feel good about yourself, and it would manifest in real life. If you feel that, if you think that, it will happen as well. So that was a very good thought to end this live session on. Thank you so much for being here. And a lot of people's questions have been answered. And I hope people found it helpful. And we have some more questions coming up on the chat. But so sorry, we don't have so much time left today. But we will be doing this every Sunday. So next Sunday, we will definitely take these
Cover all the
questions.
questions.
And yeah, yeah. So thank you so much for everyone for being here, and thank you so much, Dr. Namrata, for doing this live session with us.
So see you next Sunday, guys, and keep your questions ready. And I'm sure we'll be able to help you out. And still, if you have real serious issues, you can contact me. You can take my number from Kriti, or you can connect to me on Instagram or Facebook, and I'll be right there to help you. And in case you're visiting Delhi, my clinic is there in Bali Nagar, and you can visit me. Thank you so much.
Thank you so much.
You're welcome.